So, welcome everyone. I am Dr. Guru Prasad Peruri. I am the faculty for the NEET Super Specialty Pediatrics Division of ADR Plexus. So, we all know our NEET-SS results are out. So, as every year, now we are also conducting interviews of the toppers. The main aim of these interviews is to take guidance from the toppers so that all the upcoming aspirants can take inspiration from them and know their tips and techniques from them. So now I am going to introduce to you one of our topper, Dr. Debdip, who secured rank 60 in the very first attempt. He has just completed his MD, and in the first attempt itself, he could crack 60th rank with a score of 401 out of 600. So now we will ask from his own words about what was his preparation strategy and all. So welcome, Dr. Debdip.
Thank you, sir.
Now, how do you feel now?
Sir, happy, sir. Obviously.
Okay, just happy. Anything?
Relaxing, sir. More than happy is relaxing, sir, because there are too much uncertainty for the first few months. So now I am quite relaxed.
Okay, very good. Can you briefly tell our viewers, like, where did you do your MD? What were you doing these 6 months and all those things?
Sir, I am from Kolkata, sir. I have done my undergraduate from Calcutta National Medical College. Then I joined MD Pediatrics in AIIMS Rishikesh. Sir, I have just completed my MD Pediatrics in January 2022. And then I joined SRship there only. I'm now also doing SRship in AIIMS Rishikesh. And I continue my study with my SRship.
So it is very excellent. Like, what was your preparation strategy? Most of the students are struggling to take out time. So many of them stop doing jobs. They sit and study for a few months. So, like, what I came to understand is you are doing SRship. So you would be doing night duties. You will be having all case presentations, etc. Then how could you manage? And what was your preparation strategy?
Sir, actually, in the thing that when I was preparing for NEET-PG, I took a drop year, and that year was very frustrating for me. And I completely take oath in my mind that I will never take a drop year for preparing for any exam in future. That's why I did not take any drop or any drop from any job or something. I joined here in AIIMS Rishikesh, and here I continues doing night duties and seeing all the case. But it is actually beneficial for me because only reading is not a cup of my tea. Only reading is very boring for me actually. So ultimately, if you are studying in home, then I also say that I only 6 to 7 hours study time I can concentrate, not more than that. That time I have to find out in my duty from my duty, and that I can do very well. I chalked out my routine every day before sleep. I chalked out my routine for the next day, and obviously I have to wake up early, and I use mainly morning time before starting my duty. So I used to take 3 hours study in the morning. That is the golden time for finishing my most of the chunk of the day's routine. And then I do my duty, and after that duty in the evening time when I was not on duty, I get another 3 hours or 4 hours from that only. And even if I'm duty, when I am not seeing any patient, I usually practice MCQ or practice any small revise any small topic from Nelson. So it will be try to complete my planned routine in every day.
Excellent. It was very good. No, usually, after a few months of studying, usually we lose track of motivation. We lose motivation. Like, what was the thing that kept on motivating? How did you motivate yourself? Or any time during this preparation, did you feel low? Like, did you feel like I want to quit? I just want to do only pediatrics and leave. And how do you motivate yourself from all these things?
Sir, actually, in some time, I obviously feel depressed, or sometimes I feel there was a lot of uncertainty in my mind. And in March or April, say March and April, there was a lot of uncertainty. What I'm doing? Should I completely leave my senior residency and do study at home like other of my other friends are doing? But ultimately, what I did not quit, and when I gave mid-year April INISS there in neonatology, I got rank 19, sir. And that was my motivation. That in that time I came to realize that yes, I can do it. It will take a lot study more, but I am going to the going on the right path only. That was my motivation, and that was my I will say that was my turning point to get a rank in AIMS examination.
Okay, very nice. So, like most of the people have the same doubt. What are the books you are reading and all those things?
Sir, actually, it is simple only. It is Nelson based only. So most of the questions in this year also are Nelson based only. They are taken directly line from Nelson's, or they are somehow derivatives of Nelson's lines only. Yeah. And for neonates, always I used to read Cloharty. Actually, in my MD days, I completed Cloharty also, and that was beneficial for me. And I AIMS NICU protocol also I read selectively, and that's these 3 books only main books which I read. I did not complete Nelson fully, but I completed most of the topic and completed important topics which are repeatedly asked and which are important and daily case based. We can see those topics that I revised. I completed from Nelson, but Cloharty I read it from top to end. I completed Cloharty.
Very nice. So not only you, no one can complete Nelson 100% with confidence. That is for everyone. Only thing is, you should know that 80% of the questions usually comes from 20% of the topics. So if you try to concentrate on the 20 chapters, so you can cover most of the thing. And it is a relative exam. No, you need not give your 100. You need not get 100 questions right. If you can get most of the questions right, it will suffice.
Yes, so, after exam also I found that this was the worst exam I have given, and after that I rank came, then I realized that it is relative only.
Okay, very good. So just one more thing, like what was your exam strategy? Like how many questions you attempted? Like suppose if you don't know any question, did you go for you wanted to attempt all questions, whatever it is or not?
Sir, the thing is that in INISS, what I went through there was +3 -1 negative marking, almost +3 -1. In that, if I rule out 2 options, then I go for it. And in NEET-SS, there was +4 -1. My strategy was if I rule out 1 option, then I go for that questions. So I attempted 144 questions in NEET-SS, and I calculated that it is almost near about 109 question was right one.
Good, nice strategy. So next thing is, what will be your advice to any future PG students or anyone who is doing senior residency or something like that?
I think, sir, the main strategy is that whenever you are seeing a case, you read it from Nelson, not any other sources. You just focus in Nelson. Maybe it is boring in the first reading, but whenever you are reading repeatedly, then it will be easy. Your senior professors and all will ask question from Nelson only, and they will ask all the tough questions which appears to be tough. They are from line of Nelson's only. So if you cover Nelson, important topics of Nelson from in your residency period, junior residency period, then you just have to revise in those topics in senior residency, and obviously after passing MD exam it will be relaxing and reading will be more of fun, like that it will be not that much of pressure, then obviously grasping will be more, I think.
Okay, so many of the students will ask like how did ADR Plexus help you? Do you recommend it, or do you think just preparation is sufficient? Like on one.
Sir, I came to know about ADR Plexus. One of my friend, he has also ranked 52. Nasiruddin. So I came to know about ADR Plexus from him. So we joined together only, and we were discussing after every GT. We discussed some questions among ourselves. I did not complete all the videos, but definitely I took printout of the materials of the PDF I print out, which you have shared, sir, in the group. And I used to read from the printout that is more comfortable for me. And I completed all the questions and related links and topic. And then after that, when I was completing those those questions, I came to realize that I have not read many topics from Nelson, and there are many other important topics that I read in the Nelson's only. And that was very helpful. So there was many hidden topics, hidden tables that was not came to attention when I was reading from Nelson only. So practicing questions and from the GTs and from the test actually is very helpful to find out those topics and concentrate on those topics which you did not cover till now.
Okay, actually we designed the course also like that. We didn't want a traditional teaching, like we don't want hours and hours of teaching daily. We wanted like we will give a MCQ based give one MCQ and teach the whole topic discussed in the video and give notes. That is what our motto was. We didn't want to repeat the same topics again and again. So I think that worked.
Even the options were the 4 options were very cleverly made, and in the 4 option you read 4 topics actually.
Yeah, exactly. Like, how many questions do you think like appeared directly or indirectly, topic wise? Do you think?
Sir, obviously there were many repeats, sir. Almost, sir, obviously, which I can remember, 122 to 124 questions were not directly, the topics were repeated, like HUS. Definitely there were many questions from HUS, not one question asked, 2 to 3 questions. Congenital hypothyroidism, another topic which has been asked 2 to 3 questions. So this NEET-SS, they have asked many unheard topic, obviously, but they asked many hard topics and many common topics, and they have asked many questions from them. So that was helpful, sir.
Okay, thank you. What was our motto was, I think that we could achieve. So thanks for that. And finally, the question, like which super specialty branch you would like to opt and which college is your favorite?
So obviously I was opting for neonatology. In INISS also I gave neonatology. So I will want to do neonatology, and college I have not decided yet. So probably I will not get Delhi colleges and Chandigarh for my rank. I am expecting a college like CMC Vellore or like in Mumbai college like SET GS and or Sion, sir.
Okay. So I hope you will get your neonatology in self. I'm hoping like that. So, and I welcome to our fraternity. Myself, I'm also a neonatologist. Hope we will do good. And thank you once again, Dr. Debdip, for your interview. And best for your future. And our relation continues like this.
Yes, sir. I am very.
Thank you, Deb.